Hello, my dear students. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today, we're going to discuss the third cranial nerve, also called as the oculomotor nerve. So, now this is the pattern along which you should discuss any cranial nerve. I'm not going to read it for you. You can pause and write this down. Let's begin third cranial nerve, one of the three important nerves giving motor supply to the muscles of eyeball, also called as oculomotor nerve, externally attached to the brainstem, to be precise, midbrain, at the level of the superior colliculus. The origin. So, the origin of this cranial nerve can be divided into deep origin, nuclei within the midbrain, and superficial origin, external attachment on the midbrain. So, let's first begin to discuss the deep origin. The deep origin is by attachment to two nuclei, main oculomotor nucleus, Edinger-Westphal nucleus, both of which are found at the level of superior colliculus. So take a look. This is a section of the midbrain. Okay, you can see the substantia nigra, the crus cerebri, the oculomotor nerve nucleus, giving rise to the oculomotor nerve which will supply the muscles, Edinger-Westphal nucleus, giving rise to nerve fibers that travel with the motor fibers of oculomotor nerve, together forming the oculomotor nerve. You can see how both these are passing through the red nucleus, medialmost end of the substantia nigra, to emerge out at the medial sulcus of each of the cerebral peduncles. What are the functional components of this? So, main oculomotor nerve, Edinger-Westphal. What are the functional components? Main oculomotor nerve supplies muscles of eyeball. Muscles of eyeball are developmentally coming from pre-otic myotomes. Therefore, it is a general somatic efferent. What about Edinger-Westphal nucleus? Fibers of this consist of preganglionic parasympathetic fibers going to ciliary ganglion. From there, postganglionic going to sphincter pupillae and ciliaris muscle. This actually is the cranial outflow of parasympathetic system. Therefore, we call it a general visceral efferent. Okay, so general somatic efferent, general visceral efferent are the functional components of your oculomotor nerve. Now, what about the superficial attachment? Take a look at this beautiful image. This is your medulla oblongata, your pons and midbrain, basically your brain stem. These two are the crus cerebri, and from medial to them, you can see this oculomotor nerve emerging out as a single trunk. Why do I mention single trunk? Because you know it's actually consisting of fibers from Edinger-Westphal as well as the oculomotor nerve motor nucleus, right? Okay, so now we've completed this much. Let's go on to course and distribution. You must be thinking, oh my God, there is so much theory here. I am not going to read it. You're going to read it. I'm also not going to read it. I'm going to just keep this information for you in case you want to read it. I'm going to show you an image to understand. Come. This is midbrain. This is the oculomotor nerve emerging from the midbrain. This is superior cerebellar artery, superior cerebellar artery, posterior cerebral artery. This is your cavernous sinus, and this is the ring of Zinn in the superior orbital fissure. Now, what is the course of the oculomotor nerve? Come. Oculomotor nerve begins from the periaqueductal grey matter of midbrain, travels forwards through red nucleus, through medial end of substantia nigra, between the superior cerebellar and posterior cerebral arteries, lateral to the cavernous sinus, along the lateral wall of cavernous sinus, till it reaches the superior orbital fissure, where it divides into two branches or two rami and passes through the ring of Zinn. Okay, now what happens? This is the superior ramus, this is the inferior ramus. The superior ramus of oculomotor supplies levator palpebrae superioris and the superior rectus muscle. The inferior ramus supplies medial rectus, inferior oblique, and also gives a branch to the ciliary ganglion. So that, in short, is the course and distribution of your oculomotor nerve. Superior ramus, superior rectus, levator palpebrae superioris. Inferior ramus, inferior rectus, medial rectus, inferior oblique. Branch to inferior oblique carries preganglionic parasympathetic fibers which relay in the ciliary ganglion. Postganglionic fibers travel from here in the form of short ciliary nerves to supply ciliaris muscle and sphincter pupillae. Sphincter pupillae will constrict your pupils. Ciliaris muscle will help in accommodation during vision. So if you're liking my lectures, do like and subscribe to my channel. So what is this oculomotor nerve connected to? So the nerve is giving supply to the muscles of eyeball. But who is stimulating it to act? Understand that. This is again a section of midbrain. This is the third nucleus. This is the Edinger-Westphal nucleus. The first impulse it receives comes from cerebral cortex of same side as well as the opposite side. See how the fibers are crossing same side as well as the opposite side. So, one impulse is coming from cerebral cortex. Other connection is to the medial longitudinal fasciculus. Now, what is this? Do you remember? Come, I'll show you. So, that's the vestibular nerve nucleus. We are discussing medial longitudinal fasciculus. So, what happens is fibers from vestibular nerve run along the midline on either side, connecting to third nerve, fourth nerve, sixth nerve, seventh, hypoglossal and motor nuclei of cervical spinal cord. This is extending somewhere a little bit in the neck, okay, and along the brainstem. So what does it do? It connects all these nuclei to each other. So how does it matter that they are connected to each other? So I'll tell you what happens. So whenever you are moving your head and your neck, have you observed that your eye, your head, neck movement is coordinated and balanced? When you're trying to look somewhere, your head does not flop here and there. There is a coordinated movement of muscles of the head, neck with the movement of the eyes. Okay. So, and you're maintaining the equilibrium of the part in motion. This is because of the vestibular nerve nucleus and its fibers in the form of medial longitudinal fasciculus bringing about this coordinated equilibrium. Right. What other connections? Connections to superior colliculus. Superior colliculus nucleus. Okay. This gives rise to tectobulbar fibers. So what happens is when a truck is approaching you, okay, and your whole body turns towards the truck, okay, how does it happen that your body moves, your eyes move, everybody moves in a smooth coordinated movement? How does this happen? This happens because superior colliculus has connections to your oculomotor. While it is bringing about body movement, it is also informing the eyes to move accordingly, body visual reflex, okay, or visual body reflex. Finally, it also receives connections from two nuclei called pretectal nucleus. Now, this is fantastically interesting. Come, I will explain it to you. So, this is your Edinger-Westphal nucleus. You can see how pretectal nucleus is connected to the same side Edinger-Westphal as well as the opposite side Edinger-Westphal. Come, let's understand this a little better. So, here is your retina, which is receiving some visual stimulus. It comes and stimulates, it comes and reaches that information to that side pretectal nucleus, which in turn stimulates the same side Edinger-Westphal nucleus, but also stimulates the opposite side Edinger-Westphal nucleus. So note, even if you see from one eye, your both side Edinger-Westphal nuclei are stimulated through the pretectal nucleus of that side. How does it matter? Come. Suppose your one eye is closed, okay, and somebody throws a light in the other eye. So the light is picked up by retina, carried backwards till here. It's going to the visual cortex, but when it reaches midbrain, it gives a branch that informs the pretectal nucleus that light has been put in the eye. Okay, what does pretectal nucleus do? It informs same side Edinger-Westphal as well as opposite side Edinger-Westphal light. Light is there, okay, in this eye. What does this Edinger-Westphal do? It gives rise to preganglionic parasympathetic fibers that travel to the ciliary ganglion. Postganglionic parasympathetic fibers travel to ciliaris muscle and sphincter pupillae, and the pupil of that side constricts. This is called direct light reflex, right? So you put light, the pupil constricted, fine. But because the other side Edinger-Westphal was stimulated, it also stimulated the other side ciliary ganglion, other side ciliaris muscles to contract, pupillary muscles to contract, and the other side pupils also constrict. This is called consensual light reflex. So, when you put light in one eye, the other eye is closed, but it will still show pupillary constriction. Both eyes pupils will constrict, not only same side. Why? Because pretectal nucleus is wise enough to stimulate both sides Edinger-Westphal nucleus. So, this is direct light reflex and consensual light reflex. So, therefore, third nerve nucleus receives information from cerebral cortex, medial longitudinal bundle, superior colliculus, pretectal nucleus. What are the peculiarities of oculomotor nerve? It's got complex function, multiple functions. Not only motor supply to the nerves to the muscles of eyeball, but also it is involving preganglionic parasympathetic fibers, pupillary constriction, and so on. Parasympathetic fibers are carried by it. It has ipsilateral innervation. So, oculomotor nerve primarily innervates muscles of the same side, but note, the superior rectus receives nerve supply from the opposite side, cortex. Now, this is something very unique. That oculomotor is supplying the same side muscles, but the superior rectus of that side is getting information from the opposite side cerebral cortex, contralateral innervation. And damage to oculomotor nerve therefore has got a wide range of symptoms. Again, there are a whole lot of them I have put up here. You should read versus you should take a look at images. So, if left side oculomotor is damaged, left side eyelid will begin to droop, called as ptosis. Left side pupils will be dilated and fixed. Why? Because sphincter pupillae no longer receives nerve supply. Left side eye will be laterally rotated. Why? Because lateral rectus receives nerve supply from abducent. Abducent is having a great time now because oculomotor is paralyzed. Abducent will therefore overact, causing lateral rotation of eyeball. The eye will protrude out a little bit. The affected eye tends to show exophthalmos. Finally, when the patient tries to focus on any object, patient finds himself having double vision or diplopia. So, all these are symptoms of oculomotor palsy of that side. You should also, under applied aspects of third nerve, discuss direct light reflex, consensual light reflex, and on your own study accommodation reflex. I'll try and release a video on this, but my suggestion is some studies must be done by you. I've given you information enough for you to be able to understand accommodation reflex. Weber's syndrome. So sometimes there's an anterior lesion of the midbrain, as seen here, causing the upper motor neuron lesion of the opposite side corticospinal tract. So opposite half of the body will show corticospinal tract lesion. It will be an upper motor neuron lesion. But because your oculomotor nerve is also showing lesion at this level, this will be a lower motor neuron lesion of the third nerve of the same side. That is Weber's syndrome, typically a condition that affects the oculomotor nerve besides having the body showing contralateral hemiplegia symptoms, related symptoms. So, I hope you enjoyed the third cranial nerve and I'll see you in my next lecture. Bye. Thank you.